Rahim. Today we are going to discuss the thyroid gland being an endocrine organ, and we must know that it is essential for the normal body growth and development, especially for the neuronal tissue growth in the fetus. It has to deal with your basal metabolism, including carbohydrate, fat, and proteins, right? And your thyroid gland is being covered by a thin fibrous connective tissue capsule made up of dense irregular fibers, and these are going to give fine septa inside the parenchyma of the thyroid gland and divided into indistinct lobules, right? And serve as a passageway for blood vessels, lymphatics, and nerve fibers, right? Whenever we discuss any endocrine gland, we have to remember 4 C's. First C indicates the capsular covering, right? The second C is addressing the connective tissue septa inside. The third C is showing the capillaries, which are fenestrated sinusoidal in variety. The fourth C will be indicating the presence of cells, which could be in a form of clumps, clusters, columns, or as an anastomosing cords, or appearing as a follicles, right? Now in this picture we can see the yellow color thyroid gland and concentrate on the yellow part. You can see the parenchyma of your thyroid gland is filled with the 30 million roughly the spherical cyst-like structure. You name them as thyroid follicles, right? These are showing you the simple cuboidal epithelium, and the central cavity is well laid and filled with the glue-like material, you name it, as colloid. And you observe the fine connective tissue fibers intervening the parenchyma, right? And you can well observe that we have got well vascularity all around in the parenchyma, and we expect the lymphatic capillaries present in between, right? And there is another variety of the cell, you name them as parafollicular cells, right? In the picture you can see that there lies the follicular cells, also called as principal cells, and are normally cuboidal in shape, and their shape varies according to their activity. When they are hyperactive, we can expect them as a tall columnar shaped cells, right? And when they are hypoactive, they can be appearing as a low cuboidal or squamous like shape, right? And what else you notice about the follicular cells? They take embryological origin from that of the endoderm through Rathke's pouch, and the embryological origin of the parafollicular cells is that they are getting origin from the ultimobrachial body or neural crest cells, right? And now we have to learn the ultrastructure of the follicular cells. They are lightly basophilic and could be having the centrally placed nucleus, as you can see, and will be marked with 1 or 2 prominent nucleoli, right? And if we observe this under the electron microscope, we can see that it is showing the property of both absorptive and secretory cells. And what are they? Their apical surface, let me mark, could be having the junctional complexes in between the cells and having the small microvilli, right? And they are well laden with the rough endoplasmic reticulum near their bases, and they have got the Golgi apparatus located supranuclear region, right? Then we expect the mitochondria abundantly found over there, right? Secretory vesicles and endocytotic vesicles and lysosomes could be a part of these follicular cells, right? Now we can concentrate on the parafollicular cells, and in the picture you can see that they are located within the same basal lamina as that of the thyroid follicle, but do not share the you would say lumen of the follicles. They are larger size than that of these follicular cells, and they are of lighter stain. That is why they are called as clear cells, right? In the picture, the color is just given to highlight them, but in reality, these are not taking good stains. Why? Because they could be having some rough endoplasmic reticulum, some mitochondria, but well developed Golgi apparatus, and they are located in the basal region, right? And what type of secretion they have to produce? They produce calcitonin in response to high calcium level in the blood, and then they are gonna inhibit bone resorption and try to lower the plasma calcium level, right? So in this way they are acting as an antagonist to parathyroid hormone, and these calcitonin cells are just responding to the high blood calcium level, so they are unaffected by the hypothalamus and pituitary gland, just contrary to the follicular cells which are under the pituitary and hypothalamic control and are going to produce the T3 and T4, right? Now, through this picture, we will learn about the synthesis, storage, and secretion of the thyroid hormone. Concentrate on the thyroid follicle, and here it is in large view is showing the follicular cells. Its basal area is addressing the nearby blood capillaries through which sodium and iodide are supposed to enter your follicular cells. And here the endoplasmic reticulum, the rough endoplasmic reticulum rather, is going to secrete the thyroglobulin towards the apical surface by exocytosis, right? And now you are into the lumen of that thyroid follicular cyst-like structure. And what is going to happen? The iodide is supposed to pass through the apical iodide chloride transporter called as pentrin, right? And then it is added. Then oxidation occurs of this thyroglobulin, and you see that iodide is going to change into iodine by the enzyme thyroid peroxidase that is located near the apical plasma lemma. What is going to happen now? That the iodination of this tyrosine residues, you could say, of the thyroglobulin molecule occurs, right? The iodination results in the formation of monoiodotyrosine and the diiodotyrosine. The abbreviation you may write MIT and DIT. Now, what is going to happen? The word conjugation is written. Then comes the oxidative coupling actually occurs of the iodotyrosine residues, and they are going to form the two thyroid hormones, the triiodothyronine T3 and tetraiodothyronine, that is T4, right? Now they are going to enter the follicular cells by endocytosis, and what we expect that they are now gonna be entering into the cells, as we can see. Now proteolysis occur, and finally the active form of these hormones have made, and now they are approaching your blood capillary lumen to be circulated. And this whole phenomena of this thyroxine, triiodothyronine and the thyroglobulin molecules, they are supposed within the follicular cavity, right, as a colloid. And whenever the resorption of the colloid into the follicular cells occurs, that is under the control of, if you can recall, the hormone of the anterior pituitary, the TSH, right? And we should recall being produced by the thyroid drops of the anterior pituitary. Now, if we concentrate on the lumen area, we can see that there could be the microvilli should be there that will facilitate the endocytosis of the colloid, right? And they are membrane bound vesicles, and they are gonna reach the basal region of the cells, right? And fuse with the lysosome, and the lysosome proteases are now degrading the thyroglobulin, and we get the T3 and T4 in the free form to be entering into your blood, right? Here is a very good picture to show you the negative feedback control mechanism regarding your thyroid hormone secretion. Concentrate, there is hypothalamus at the top, and then you can see the pituitary hormone. From the hypothalamus, the thyroid releasing hormone could be acting on your anterior pituitary. And why this happens? Whenever your body is feeling cold or low body temperature, that becomes a stimulus to your hypothalamus, and it has to release thyroid releasing hormone. It causes anterior pituitary to release TSH, right? Thyroid stimulating hormone. Then it stimulates your thyroid, and it will release T3 and T4, and these are gonna stimulate the target organ to cause the increased metabolic activity. And what happens next? That the increased body temperature again sensed by your hypothalamus, and what is gonna happen now? That the secretion of TRH by hypothalamus is inhibited, and thyroid hormones, these are also blocking the thyroid releasing hormone receptors, right, on the thyrotropic cells, leading to the inhibition and release of thyroid stimulating hormones. And in this way, they are indirectly dampening the thyroid hormone production in the thyroid. And we get the normal feedback loop mechanism that exists in between your hypothalamus, pituitary, and thyroid gland. And here in the picture, we can address some clinical or medical application of it. In the picture, you are looking a case of hyperthyroidism or a Graves' disease. We expect an autoimmune disorder in which the antibodies are supposed to be a source of chronic stimulation of the follicular cells, right? And they are causing the thyroid hormone secretion excessively. And in this hypermetabolic state, the what feature we expect in the patient could be, you can see the protruded bulging eyes, and we expect the weight loss, nervousness, sweating could be a part of it, heat intolerance are in these patients of the hyperthyroidism, right? And sometimes we expect the cut section histological view in which the simple cuboidal epithelium is now being replaced by the columnar epithelium, right? And if we expect some hypothyroidism case, we can find that here a patient may come with a fatigue, weight gain, or other changes, and sensitivity to cold is there, depression and memory problems, and other enlisted symptoms and signs be a part of it, like goiter, hair loss, muscular pain, etc., right? And we expect that they are due to the inadequate secretion of the TSH due to local inflammation of your thyroid gland. And this TSH secretion is lessened by the anterior pituitary, and we expect these symptoms, and there could be the inability to concentrate. So all these are the features of hypothyroidism and the previous discussed topic, the hyperthyroidism, right? And this is a diagram to show you the cut section histological view. You can see multiple thyroid follicles lined with the simple cuboidal epithelium, and you can observe the intervening connective tissue septa, and they are addressing the blood capillaries. And what else you can find? You can find the parafollicular cells, C cells, that are supposed to produce calcitonin, right? Another enlarged view to show you the colloid in the thyroid follicle, and then you can see the nuclei of the follicular cells, and you can find the parafollicular cells and the blood capillaries nearby, right? This is again a histological view of a slide to show you the thyroid follicles filled. This is the slide you will observe in the lab, that there is the lower sided connective tissue capsule, and you can see the multiple colloid filled follicles all around in the parenchyma, and the well vascularity is there. So that is all for today.